I would like to greet everyone. Today it's Sunday. It's July 31st, 2022. This is the last day of July. My name is Yanick Dantiste. I am a family nurse practitioner who has been working as a nurse practitioner in West Palm Beach, Florida. So the topic of today will be one of the rare disease called listeriosis. This is the name over here, listeriosis. So this is one of the rare disease. The reason I have decided to talk about with that disease is because whenever we have new outbreaks, new cases. So the health department always, send us a communique. So send us some information. So we have to watch for. We have to be um, open minded to look for those kind of symptoms. So this is a rare disease, and we're going to talk about the sinus symptom, who is at risk to contact it, and also if it can be treated. As usual, before we start, let's begin with an inspirational quote by Barbara Law that I like. That's why I would like to share that with you. So the inspirational quote stating like this: "Do everything with a good heart and expect nothing in return, and you will never be disappointed." I'm going to repeat it again, and it's so true. So I think uh, Miss Barbara Lush is so right. So the inspirational thought is do everything in with a good heart and expect nothing in return, and you will never be disappointed. End of quote. Which is true because if you do something like, let's say you are doing something for someone, if you expect something in return, the same person will disappoint you. No matter who is it. It can be your best friend, it can be your children, it can be your mate, uh, your family member, whoever. So whatever you do it with your heart and never expect nothing back. So um, let's tackle about listeriosis. What is it? So I'm going to, okay. So what is listeriosis? Okay. So as I said before, listeriosis is a rare disease, and also it's a serious infection. That disease is caused by a bacteria called Listeria. Okay, the bacteria who cause that called Listeria monocytogenes. Monocytogenes. So this is the bacteria who cause that disease. Again, this is a rare disease, and it's when somebody contacted, that can be serious and fatal. So who is at risk for that disease, for listeriosis? Okay, we have pregnant person, pregnant women, newborns, they are at risk. Elderly persons, uh, and also people who has uh, weakened immune system. So people who is immunocompromised, such as people who have AIDS, people who has cancer, people who has diabetic and kidney disease. Okay, those people, their immune system, is already weak because of their diseases, so they are more at risk to contact lister, listeriosis. So also we have to know that where can we find that bacteria? So listeria, which is the bacteria who cause that disease, which is listeriosis, okay, is commonly found in the environment. Okay, so we can find it in dust. Okay, that bacteria can be found in dust, soil, water, sewage, silage, and and also it's known also to cause the disease in animal as well. Okay, so the animal also can have that also. And also it has been found that um, we can find listeria, which is the bacteria. We can find it also in meat, in vegetables, in seafoods, and dairy products such as your milk, your eggs, your cheese. Um, Listeria can multiply in refrigerated food. That's why it's so important to observe the um, the the temperature in your fridge. Okay, it shouldn't be um, too hot because if the temperature is not the right one, this is a good ambient for the bacteria like listeria to multiply. So pasteurization of dairy uh, product and proper cooking are usually adequate to kill the bacteria. So if your food is if you cook your food right, and also your dairy product has been pasteurized the right way, so they said that's enough to kill the bacteria listeria. And also the bacteria can also live in your GI tract, in your intestinal tract. uh, uh, so that person can be infected, and that person, they might not have any symptom. So the bacteria can be in that. Let's say that somebody eat contaminated food. Okay, so that individual might have that bacteria inside their GI tract, but that person will be asymptomatic. So that person won't necessarily have symptoms. Listeria infections are caused by eating contaminated food, by having direct contact with infected animal or from a pregnant mom passing the infection to a baby, or is, so how can you, how listeria, the infection can be contacted. You can contact it, that infection, that listeriosis. You can contact it by eating contaminated food, and such as, meat, vegetables, seafood, or dairy products, and also uh, by having direct contact with infected animal, because uh, the an animal can contact it too, and also a baby can have it by their mom, which can passing through it. Infected and also what we need to know is that infected individual may spread the bacteria to others for up to several months. Okay, this is not something days, it can take months. Symptom can be mild in healthy in individuals. So let's say somebody is pretty healthy. So they said that person who is infected with the listeria, their symptom can be mild, but um, some can have, so people who have weakened immune system, like people who have AIDS, people with cancer, people with diabetic or kidney disease, those people will have more severe symptoms. Symptom, okay, what are the symptoms of listeriosis? Okay, the symptom can be plenty. So, the symptom you can have, okay, remember, anytime someone is affected with anytime someone is infected with either viral or bacteria, the likelihood for that person to have uh, fever is high, because your body is trying to fight it. Okay, so the first one is fever. This is the first symptoms when you have when you are infected with listeria. And also you have muscles ache. Um, Also, you're going to have your GI symptom. Your GI symptom can be what? Can be your nausea, your vomiting, can or that uh, diarrhea. So this is the same symptom like if you have a food poisoning. Okay, so you're going to have fever, muscle ache, nausea, vomiting, diarrhea, and also if the infection spread, okay, if that the infection spread to your nervous system, then you're going to have symptoms such as headache, stiff neck, okay, confusion. You're going to have loss of balance. So when you're trying to walk, you cannot walk straight. You're going to lose balance because that bacteria is affecting your nervous system. And also convulsion can occur, like seizure type that can occur, like say something with epilepsy. Okay, and after exposure with that bacteria, the symptom usually can can appear within 3 days, okay, to 10 weeks. So this is a long uh, interval, 3 days to 10 weeks. And so most often within the 3 weeks, so they said that if someone is affected by Listeria, which is the bacteria who cause the listeriosis, that person can be the symptom that person can be affected. That symptom can show up from 3 days, up to several weeks. But they said surely, within 3 weeks, that uh, individual will start having symptoms. And also, pregnant women who become infected with that bacteria, generally they only develop flu-like symptom, just like fever, chills, um, tiredness, their body ache. Okay, so however, with the pregnant women, if a pregnant woman is affected by that bacteria, that can cause premature labor. So that pregnant women can have the baby, the newborn before uh, his or her time. And also, the pregnant women can have miscarriage and stillbirth. So that baby can die. So this is a very, as you see, this is a rare disease, but the consequences can be fatal. Okay, it can be serious. That's why they said listeriosis. It's that's why they said it's rare, but it's a serious disease. So that's why once someone think that you might be affected, it's good to seek help as soon as possible. So again, if you think you have listeriosis, okay, you should see a doctor or a provider. Okay, it doesn't have to be a doctor. It can be a nurse practitioner, a physician assistant, whoever you've been seeing. So you can call them, let them know what is your symptom. Or if you don't have health insurance, if you don't have a doctor, go to a public health center close to your home. Okay, because it's important. They need to do more tests. They need to start you on treatment if it's that you have. And also, which is, the good thing is listeriosis that can be treated with uh, antibiotics. So, which is good because some infection disease they can't, they don't have treatment. But this one, they can give you, they can treat you with with antibiotics, which is uh, excellent. So, how can listeriosis prevented? How can we prevent having that disease? Okay. First of all, they said keep uncooked meat separate from vegetables, from cooked foods, and ready to eat food. So that's meaning you don't mix those uncooked meat with um, everything, because sometimes you see some people take their meat from the freezer and they put it in the fridge and they leave it there. This is a very unsafe habit to have. If you're going to cook a meat, just cook it, don't leave it there, thaw let it thaw inside the fridge. That can cause cross contamination and can make people sick. um Sorry, my phone. And also uh they encourage people to cook your food very, very well throughout. Cook your meat, it's, your meat such as your beef, your pork, your poultry, cook it well through, throughout. So by doing that, the likelihood for someone to be infected with with Listeria bacteria will be very slim. Also, what they also they advise to wash raw vegetables throughout before eating. So before you eat your vegetable, you wash it well. Personally, I like to put some vinegar, you know, in the water in the water that I'm going to wash my vegetables. So that can kill, that will kill some bacteria and that will help. So you wash anyway. They advise you to wash what your fruits. What is not only veggies, that can be fruits too. Before you eat them, wash your fruits, wash your veggies. And also, the advice to wash your hands. This is the 101 uh, infection control measure. You wash your hands, or you have your hands sanitizer. If you can wash your hands, you use it too. You wash your hands. You wash your knife well. You wash your cutting board, because the knife, the cutting boards can be infected with that bacteria and other contaminated surface after contact with uncooked food. So that's why after you finish cooking, if you use a board to cut your meat, it's good you wash your board and you bleach it. You put vinegar, you bleach it, so to kill all the bacteria, all the uh, bacteria that we cannot see. And the advice also for people who is high risk, okay, may choose to avoid soft cheesy, cheese who is soft, pate like liver pate. So avoid that, and also to avoid the ready to eat meat like the processed food, like your salami, your ham, uh, your turkey thing. So they said people who is high risk. So again, high risk uh, um, people who can contact it, that is pregnant women, it's the newborns, elderly person, and individual with weakened uh, immune system, people who has AIDS, people who has cancer, diabetic, and people who have kidney disease. They are the people who are at risk to develop listeriosis. Um, so this is that disease. We don't hear people talk much about with that disease, because um, the only thing we will hear is that, oh, someone has a food poisoning. Okay, when somebody they finish eating a food and then they have nausea, diarrhea. So that's why they said, but they don't know exactly wh- what kind of food poisoning, because there's different kind. So listeriosis is one of them. And but the lister uh, but the thing is, listeria bacteria, we don't only found it, inside the food. You can find it in the dust, on the soil, in the water, sewage. Um, so and beside, the your meat, beside the seafood, the milk product and your vegetables and your beef and your pork. So so this is something we have to keep in mind, okay? And it's so something also we have to know if we have that disease to seek help as soon as possible because that can be treated, okay? In any disease, once we discover it on time and we go um, and we seek help on time, so we have more chance to fight it. We have more chance. The outcome, to succeed is high. But if we wait, we're trying to treat it at home with things that we don't even we're not even sure what it is. So that can be too late. So once you have your symptom, and then yeah, you can start by like let's say, especially if somebody they're home, right? You're home, you feel sick, you have nausea, vomiting, diarrhea. It's not the time to eat. It's not the time. You need to keep your GI tract rested, okay? Keep it rested. Maybe you had tea, but try not to put something. Try to drinking is okay, but don't try to eat. Try to rest your GI tract, because sometimes also if you go to the ER, there is tests they can do, and it's good if your stomach is empty. So again, remember, the sign of symptom. So once you have those sign of symptoms, seek for help. Call your doctor, your provider, and so you can be treated. And the good thing with listeriosis is that they have, that can be treated with medication, with antibiotics. So which is good. Again, we need to. We have only, as you know, we have only one health. Okay, God give us only one health. Once we don't have it, it's hard to get it back. Okay, so we have to cherish your health. You have to do everything possible. There is nobody, and again, I'm going to say it again. There's nobody who has, an excellent bill of health, like an excellent health. There's no one. I don't have it, and I don't expect no one has it too. Um, everyone, we are striving to do the best we can to keep us healthy. So we should aim for an optimal health. Okay, optimal health meaning that this is the maximum health I have, and I'm functioning well. I don't have no acute diseases. I follow what my um, primary care provider told me to do. If I am on medication, I'm taking my medication. I am eating well. I'm eating more fruits, more vegetables. I'm drinking enough water. Our body or the body has a way to tell us when we are thirsty. So we need to start to listen to our body. Do not shut it down. When our body tell us to drink, we drink. When our body tell us we have to go pee, we go pee. So sometimes we are so busy, and our bodies send us a signal for us to drink, but we are so busy, we don't drink, we become dehydrated, and the dehydration will lead to urinary tract infection, all the 9 yards. So learn to listen to our body, okay? Take rest, take plenty of rest. I know it's not easy, but try. Eat a lot of fruits and vegetables. Um, get in enough sun, even though it's 5-10 minutes you can get per day. Try to get it, especially people who lives in the sun and uh, tropical place. try to get your sun, and also try to sleep, try to sleep to rest. Is by sleeping your cells, they are multiplied, they are rejuvenated. So always promote healthy living, because remember, we have only one health, and once we abuse it and once we don't treat it the way we should treat it, there is consequences. And um, my goal is to see everybody with optimal health, and this way we can enjoy, whatever we whatever your goal, you can enjoy it. So on that, I'm going to stop, and I'm going to wish um, everyone the best of health. Bye bye, next time.